Imagine this. You or a loved one just came home from the hospital after a serious illness or surgery. You're relieved to be home, but suddenly you're faced with questions. What kind of care will you need? Who will provide it? How much will it cost? And most importantly, what does Medicare actually cover when it comes to home health or hospice care? If these questions have ever crossed your mind, then you're in the right place. Today, we're going to walk through everything you need to know about home health and hospice care under Medicare, your rights, and what you can expect in terms of costs, so you can make informed decisions for yourself or your loved ones. Home health care is different from the care you receive in a hospital or nursing home. It's specifically designed for people who are homebound, meaning leaving the house is either extremely difficult or medically inadvisable. Medicare provides coverage for home health services, but there are strict rules you need to know. First, your doctor must certify that you need care at home. This isn't just a casual recommendation, it's a formal requirement for Medicare coverage. Secondly, you must be under the care of a doctor who establishes and manages your home health plan. This ensures your treatment is personalized and appropriate for your condition. So, what does home health care actually include under Medicare? It can cover part-time or intermittent skilled nursing care, physical therapy, occupational therapy, speech-language pathology, medical social services, and sometimes home health aid services. Part-time or intermittent means the services aren't around the clock. Medicare won't cover 24-hour care in your home, so it's important to understand what is considered reasonable and necessary care. Now let's talk about cost, which is always a major concern. The good news is Medicare covers home health care largely without any out-of-pocket cost for the patient. You won't pay for covered home health visits, and Medicare also covers medically necessary equipment like walkers or hospital beds if prescribed. However, there may be some exceptions, especially if you need medications delivered to your home, or if your home health aide provides personal care beyond what's covered. It's essential to ask your provider in advance to avoid surprises. Knowing your rights is just as important as understanding the services themselves. Under Medicare, you have the right to choose your home health agency. You aren't required to use a particular provider, and no one can penalize you for choosing a different agency that meets Medicare requirements. You also have the right to be informed about your care plan. This means you should receive a detailed written plan that outlines the services you will receive, how often, and for how long. If anything changes, your provider is required to notify you and your doctor immediately. Shifting gears to hospice care, this is a separate but equally vital component of Medicare. Hospice care focuses on comfort and quality of life for people with terminal illnesses. If your doctor certifies that you have 6 months or less to live if the illness runs its normal course, you may qualify for hospice services. Hospice care can be provided at home or in a hospice facility, depending on your needs and preferences. The goal is to manage pain and symptoms, provide emotional support, and assist your family with caregiving. Medicare covers hospice care almost entirely. You typically pay nothing for the services, including nursing, social work, counseling, and medications related to your terminal condition. There may be small copays for certain prescriptions or respite care if a family caregiver needs a temporary break. But overall, hospice care under Medicare is designed to minimize financial burden while maximizing support and comfort. It's also crucial to understand that choosing hospice doesn't mean giving up your right to other medical treatments. You can still receive care for unrelated conditions, and you can even leave hospice if you or your family decide that a different approach is needed. This flexibility is often overlooked, so it's important to have an open conversation with your healthcare team about what's best for you. One thing seniors often worry about is what happens if you're discharged from the hospital and need more care than you expected. Here's the reality. Medicare's rules can be complex. If you're no longer considered homebound, coverage for home health services may stop. However, you can appeal or request a reassessment. The key is staying proactive and communicating with your doctors and the home health agency. Knowing your rights allows you to advocate for the care you deserve. Many families are also unsure about the difference between home health aides and personal caregivers. Medicare covers home health aides for skilled care tasks, like changing dressings or helping with certain medical equipment. If you need assistance with daily activities like bathing or dressing beyond what's medically necessary, Medicare may not cover those costs. That's where private pay or long-term care insurance may come in. Understanding this distinction can save you both money and stress. It's easy to feel overwhelmed when navigating these options, especially during times of illness or recovery. That's why staying informed is your most powerful tool. Make a list of questions for your doctor and your home health agency. Ask about what services are covered, how long they'll last, who will provide them, and whether equipment or supplies are included. Never hesitate to request written documentation of your plan of care. Medicare requires it, and it protects you. Here's a practical tip. If you're considering home health or hospice care, involve family members or trusted caregivers in the conversation. Having another set of ears and eyes can help you catch details you might miss, like cost-sharing obligations or frequency of visits. It also ensures everyone is aligned on expectations and can advocate for your rights if needed. Before we move on, I want to give you a quick reminder. If you're finding this video helpful, make sure to subscribe to Medicare Mentor. By subscribing, you'll stay updated on all the latest tips, rules, and changes in Medicare that could save you or your loved ones thousands of dollars. It only takes a moment, and it can make a world of difference in your healthcare decisions. Now let's touch on an often misunderstood topic: how Medicare coordinates with other insurance. If you have supplemental insurance, sometimes called Medigap, or an employer plan, it may cover additional services or costs not included under Medicare. This can be especially useful for things like extended home care, certain therapies, or durable medical equipment. Always check with both your Medicare plan and your supplemental insurer before committing to services. Being proactive can prevent unexpected bills and stress. Another question I hear a lot is, what happens if you need home health or hospice care while traveling or living in another state? Medicare will generally cover services as long as you meet the eligibility criteria, but availability of providers can vary by location. Planning ahead and contacting agencies in your destination area is essential. You want to avoid gaps in care, especially if you're dealing with a serious illness. Let's address one more misconception. Hospice care isn't just for the very last days of life. Entering hospice early can actually improve quality of life, provide symptom management, and reduce hospitalizations. Many families report feeling more supported and less stressed when they take advantage of hospice services sooner rather than later. It's not about giving up hope. It's about choosing comfort and dignity while maximizing support for both the patient and their loved ones. Finally, one of the most important things to remember is this: you are your own best advocate. Understand your rights, review your care plan, ask questions, and involve your family. Medicare provides strong protections and coverage for both home health and hospice care, but it's up to you to make sure those benefits are fully utilized. If you take one thing away from this video, let it be this: knowledge is power. By understanding exactly what Medicare covers, your rights as a patient, and how to navigate costs, you can ensure the best possible care for yourself or your loved ones without unnecessary stress or financial burden. Thank you for spending this time with me today. If you want more guidance, tips, and strategies for saving money on healthcare while navigating Medicare, make sure to hit that subscribe button for Medicare Mentor. We're here to help you make confident, informed decisions so that you and your family can focus on what truly matters: health, comfort, and peace of mind.